Good evening, I'm Dennis Ward, and this is Face to Face. Our guest this week is Dr. Marcia Anderson. Dr. Anderson is Cree Anishinaabe and grew up in the north end of Winnipeg. She is a physician and Indigenous Services Canada's Medical Officer of Health in Manitoba. Dr. Anderson, thanks so much for taking time out of your no doubt busy and hectic schedule to be on the show with us.
Well, thank you for having me on today.
We're nearly 1 year into this global pandemic. Just wondering how you reflect back on that.
I think it's been an incredibly busy year with so many ups and downs. I think about the impacts on my family and my kids and how they now talk about what they're going to be doing in 10 years if there's not a pandemic. But on the high side, I think about seeing my Indigenous colleagues and experts across the country and within Manitoba really leading the way on an informed, evidence-based, thoughtful approach, and the partnerships with community leaders who are using all of their powers, relationships, knowledge, and skills as well to try to protect the health of the communities as best as they can. And those are the things that are giving me hope as we continue on this marathon.
When you were going through medical school, did you ever think that one day you'd be dealing with a global pandemic?
It was not on my radar at all, I have to admit. The closest thing to this, it didn't come till H1N1. I'd been in practice for 2 years, and even that was nowhere near the scale of what this COVID-19 pandemic has been.
Given the global scale of this, do you feel like, I mean, we're hardly out of it yet, but not quite 1 year later that, you know, we've got a vaccine already and people are getting vaccinated. Are we doing pretty good, all things considered?
I think we definitely have some things that we can be proud of. So for example, yesterday in Manitoba, we opened up a pop-up vaccine clinic for First Nations healthcare workers and started that off with a ceremony with traditional healers and knowledge keepers who are eligible to receive the vaccine in Manitoba. And where I compared to where we were 5 or 10 years ago, that would have been probably impossible to see. So things like that show me we are on the right type of track.
I was just going to ask, you know, we just recently had our lowest case count in the province of Manitoba since back in October of last year. Is that a sign that we are on the right path?
I think we are seeing the effects of the tougher restrictions in Manitoba, which had to come into place because of the high number of cases and the strain on our healthcare system. And so now we're going to start to see some loosening of those restrictions, some gradual and safer return back to some more usual activities. And I think what is going to show if we're on the right track or not is if we can do those things safely, still keeping our non-household contacts low so that we don't see our case numbers rise to the same extent that we saw back in the fall and earlier in winter.
It's no doubt been a tough 2+ months here. We are going to soon see restaurants reopen with restrictions and gyms and things like that. Is now the time to be reopening?
I think when we look at the low case numbers and we also consider the non-COVID impacts of the restrictions, we do have to have some cautious reopening. There's a lot of people whose jobs and livelihoods have been impacted, and that really has a lot of broader health impacts too. There are people who are feeling the effects of social isolation and not being able to access some of their points of connection or physical wellness. So I do think we're at a point where we need to look at the balance between the risk of COVID and the risk of these non-COVID health impacts and open up cautiously. But we need to be very diligent around how we do that so that we are not really increasing our risk of COVID too much.
Northern Manitoba has been kind of leading the way in the number of cases in recent weeks. What is the situation? Has that improved in Northern Manitoba?
Yeah, I was looking at the epidemiologic curve yesterday, which is that graph that plots all the new cases. It's available on the Manitoba government website, and it does seem to have peaked and come down. And that really speaks to individuals cooperating with the health workforce, with public health, following the isolation rules, getting tested. And so also in northern Manitoba, we are seeing improvement.
The military arrived in Pungazi First Nation on the weekend, about 300 kilometers north of Winnipeg. What's the situation there?
You know, I think Pangasi, like several other communities, was experiencing some impacts to community continuity. And so somewhere like Winnipeg, you wouldn't necessarily notice as much if someone who works at one of the water treatment plants goes down, for example. In some of these much smaller, more remote communities, you might only have a very small handful of people doing things like driving water or sewage trucks or maintaining the water treatment plant or delivering food hampers and essential services like that. So I think they were experiencing some of those community continuity challenges and needing some assistance with those things. So happy to see those supports coming into the community.
What role does the military play when they arrive in a community?
So I can't speak firmly to that. I don't think there is a set plan. I know that one of the things that happens is they do these reconnaissance type trips, or sometimes now I hear they're being done virtually, where they really assess what the needs and gaps are, and what local resources or additional resources have already been put in place that can meet those different needs. And then they really tailor their mission in the community to meet those needs. So earlier in the pandemic, when we saw the outbreak in the personal care home in Opaskwayak, for example, well known that that was more of a medical deployment to support staffing in the personal care home. In some other communities that have had deployments, it's been more focused on these community infrastructure, community continuity pieces. So it really is tailored to what the needs of the community are.
We're obviously starting to see the vaccine now, and we're going to talk about that, Dr. Anderson. We're just going to step aside for a quick break, and then we'll continue the conversation here on Face to Face with Dr. Marcia Anderson. Stay with us. Welcome back to Face to Face. Our guest this week is Dr. Marcia Anderson, a medical officer of health in Manitoba for Indigenous Services Canada. Dr. Anderson, First Nations people on the prairies have been hit particularly hard by the pandemic. In Manitoba, the number is nearing nearly 10,000 cases in about 1 year, and currently First Nations make up about 85% of all cases in the province. So what's behind that?
So we were positioned to experience the pandemic in the context of long-standing challenges like overcrowded, inadequate housing. And when we think about the way that the coronavirus spreads, which is through respiratory droplets between people who are in close contact for more than 15 minutes, and we think about the need for self-isolation, which means ideally private bathroom and private bedroom, those housing challenges make it really difficult to isolate properly. And then the other, key aspect we would think about is the ability to quickly be tested if you develop symptoms, or tested at the appropriate time if you've been a close contact of someone with COVID, and that test, trace, isolate cycle in the context of long-standing inequitable access to healthcare. And I think those are two examples of why rates have been so much higher amongst First Nations people.
Yeah, despite calls for, medical services, better services in community, many First Nations still have to leave and come to Winnipeg for medical treatment. What role has that played, do you think, in the spread of the disease as well?
So unlike H1N1, where early access to healthcare and treatment with Tamiflu could really change outcomes, the medical treatment for COVID-19 is not the biggest determiner so much as quickly identifying cases and isolating people. So the delays that we've been seeing have been more in terms of having case investigations done, getting the contact tracing done in a timely fashion. We think about challenges with nursing levels, for example, in some of the nursing stations or health centers to do those things. So some of our big successes have been the multi-stakeholder collaborations, bringing in rapid response teams, other regional health authorities deploying staff. But quite often the time it takes to arrange those things means we're already starting kind of behind the game a bit with already more cases and contacts than we would like, and then we're trying to halt the snowball effect. So it's more those public health system supports and the speed with which they can be deployed or can do that test, trace, isolate cycle. And the challenges with medical care have more to do with people with more severe illness. And we've talked some about pre-positioning people, for example. So encouraging people to isolate outside of the community, closer to healthcare if they are more at risk of severe illness, to ensure that they can access it appropriately if it becomes needed.
First Nations it fared pretty well in the first wave of the pandemic, but not in the second wave. Was there a difference there that led to the spike in the numbers that have province-wide, really?
Yeah, the two waves were very, very different in terms of the transmission dynamics and who is being impacted. And so in that first wave, we saw a lot of travelers being infected and then bringing the infection into Manitoba with them. Whereas in the second wave, we saw way more community transmission, people acquiring the infection within Manitoba and then spreading it through households or other close contacts. So those transmission dynamics were incredibly different. And so that is why we've seen so much more disproportionate impacts in this second wave compared to the first wave.
You mentioned the impact that housing has had and access to health care. Do you expect there'll be greater calls and hopefully more funding for these types of things in communities?
Yeah, I think, we can look at the short-term responses and really celebrate some of the federal investments in healthcare and in the communities to be able to respond to the acute needs of the pandemic, whether that's security checkpoints, isolation accommodations, enhanced testing services, supporting our rapid response teams. But at the end of this, and even really as we move through this, I think we really need to look at what the parallel long-term investments need to be so that next time a crisis like this occurs, we are not starting from this point of significant disadvantage.
We also know, institutional racism in the healthcare sector plays a big role in access to care, even when there's not a pandemic on. Have you been hearing stories like this, though, during the pandemic?
I would say yes, and in a few different ways. One thing we have heard, and something I've, felt concerned about myself, is when our relatives go to the hospital and the no visitor policies means they're there alone, and concern about who will advocate for them if they are experiencing racism and are not in a position to advocate for themselves. So that is one part of the concerns and is leading to some people avoiding accessing healthcare because of it. People sometimes are afraid to access any care or resistant to accessing care because of past negative experiences. And so we might see that impact who will go for testing or who will answer the phone when public health is calling. We certainly saw lower uptake or lower agreement to go into the provincially run alternative isolation accommodations. We have been able to develop a partnership with the First Nations Health and Social Secretariat of Manitoba to provide some wraparound culturally safe services within AIA. And as case numbers and contacts rose over the last few months, with those supports in place, we did see more people going into AIA. And I think that really speaks to the need for that collaboration between mainstream healthcare organizations and Indigenous-led organizations to make the services more culturally safe and appropriate. And, the last thing I'll just mention, and the tie into vaccines, is some concerns that have been raised around past experiences with medical experimentation without consent on First Nations people, which of course also would be a form of racism. And the concern that this vaccine was approved very quickly and maybe we're being experimented on again. And I want to assure people that that's not the case. There have been rigorous studies and approval processes that have been gone through, but these are the long-term impacts that experiences of racism in healthcare do have that are impacting the COVID pandemic.
I'll talk more about that if we get a chance here too, but like you mentioned, the vaccine rollout is underway. Can you give us an update on how that is going on First Nations in Manitoba?
Sure. So our first allocation of doses have gone out to all 63 First Nations communities. And that was focused on healthcare workers in remote isolated communities, personal care home residents and staff, or elder care facility residents and staff in First Nation communities, elders over age 60 in remote and isolated communities, and over 70 in all other communities. In addition, last week we announced that we were expanding eligibility and had been allocated some additional Moderna doses. And within this expanded eligibility, opened it up to traditional healers and knowledge keepers. I would say with this initial rollout, overall uptake has been very good, actually. There have been a few communities where uptake was lower. We will continue to work with community leadership and the health workforce to provide up-to-date, validated information in ways that are accessible to community members. But overall, uptake has gone really well so far.
You know, despite there being concerns over having enough vaccine, Minister Mark Miller said that that's not going to be an issue on First Nations. Is that your understanding of how things are still going?
I think it's a matter of timing, really. Certainly, we have a lot of communities where more people want to be vaccinated now than we have vaccine available for. So if we're talking about over the next 6 months, then I think that is true. If we're talking about this moment in time, we did not have enough vaccine to offer it to every First Nations person who would have wanted it yet. In addition, we have not had significant enough amounts to do off-reserve First Nations people, particularly older people. And so that is a high priority for us as soon as more vaccine becomes available.
We're talking a bit about the hesitation that people might have taking the vaccine. Well, what are you telling people to alleviate those concerns?
So the one thing, some of the key messages we're discussing are to talk about the studies that have been done that showed both the effectiveness of the Moderna and Pfizer vaccines as well as the overall safety. We do talk a bit about the approval processes, about the ongoing safety monitoring. I think one thing that's been really important, though, has been communities posting pictures of their elders receiving the vaccine. Because so many people will trust the elders and will follow the direction of these really important wisdom holders within our communities. So I think that peer-to-peer experience sharing is also a really important part of the communication strategy.
You were part of an event to announce the launch of a pop-up vaccination site in Winnipeg for First Nation knowledge keepers, traditional healers, and healthcare workers. How important is getting that up and running?
So we all recognize how important traditional healers and knowledge keepers are to the health of our families and communities. And so we were concerned that in the off-reserve setting, that there may be people who were being missed because we didn't have that off-reserve accessibility. So we were really pleased to be able to work with our provincial counterparts to open up the pop-up site and to expand the eligibility. It was a beautiful day to sit, of course, safely, socially distanced, but we had an opportunity to sit, to smudge, to hear the drum sound and a song sung, and to pray for the health of our communities and for the healthcare workforce overall. And I did receive feedback that our provincial counterparts who are operating the site were really pleased and touched to be able to participate in that ceremony as well. And that really speaks to how an equitable, evidence-based allocation really serves all Manitobans.
Good news for sure. Dr. Anderson, more to talk about here. We've just got to step aside for another quick break, and then we'll continue the conversation here on Face to Face.
For most people, when we think of racism, our immediate understanding is of personally mediated racism. We can easily see interpersonal racism in the words and actions of people who have come to believe that a certain group of people is inferior to another group of people. This bias can be conscious or unconscious, and even if unconscious, can influence behavior and clinical decision-making, as done in research largely documented in the U.S. Recently, the College of Family Physicians of Canada released a report on the health and healthcare impacts of systemic racism on Indigenous peoples in Canada. They refer specifically to the case of Brian Sinclair, an Indigenous man who was referred to the emergency room by a community physician. He waited 34 hours to receive care, vomiting on himself, and with other ER visitors asking nurses and security guards to help him. When they finally checked on him, they found that he had been dead for several hours, of an untreated but completely treatable bladder infection.
Welcome back to Face to Face. Our guest this week is Dr. Marcia Anderson, Medical Officer of Health for Indigenous Services Canada in Manitoba. Dr. Anderson, this is probably a tough question related to the vaccine, but do we have a sense of, when everybody might have been vaccinated?
I don't have a great timeline. I know in Manitoba they were saying 70% by the end of the calendar year, but of course that was prior to some of the supply shortages. So much like you, certainly watching and waiting to hear more information being shared. I will say that around March, April is when we're expecting volumes to really significantly increase in terms of eligibility and how many people will be able to be vaccinated.
Dr. Anderson, we don't get to have too many doctors on the show, and you were the youngest Indigenous graduate from the Faculty of Medicine in Manitoba at the age of 24, the youngest president of the Indigenous Physicians Association of Canada. Just wondering if you could tell us about your path and how you've managed to achieve these goals.
Well, thank you for that. I think one thing that's a bit different about me is I knew I wanted to be a doctor since I was 4. Certainly couldn't imagine the way I would be being a doctor at this point in time, but was always really focused and was very fortunate to have a very supportive family. So I think about in my undergrad and medical school years, being able to live at home and my mom helping with my laundry and my dad, driving me places until I got my own car, to now where my parents are still helping with my children while I'm working long hours. I think about the circles of Indigenous physicians and other colleagues who really are such an important part of the team, who do a ton of the work and who really are critical supports for me. And I think those are the biggest factors in how I've been able to do this work, has been the supportive family and community.
Definitely very important to have those support systems around. We're almost out of time here, but just wondering if you have any advice for those out there that are looking to get into the medical profession.
So I think one of the most important things is to keep believing that you can do it. There's lots of supports available out there, whether that's your guidance counselor or teachers in your school. Reaching out to the university access programs or Indigenous student centers early when you're in junior high and high school, getting to know them, getting to know what supports are available, making sure that you are taking the prerequisites that you need to get into university. People will be there to guide you along the way as long as you keep believing in yourself.
Well, Dr. Anderson, we really got to thank you. You're an inspiration for sure for many out there as well.
Well, thank you. That's very kind, and I'm so honored to be able to do this work.
Well, and we do thank you for that work, and thank you for taking the time to be with us this week on the show.
Thank you for having me again.
And that is all the time we have for this week. You can catch up on any episodes you may have missed by visiting our website, aptnnews.ca. This episode and all previous episodes are also available as podcasts. You can find those at aptnnews.ca/face-to-face podcast. I'm Dennis Ward. Thanks for tuning in to Face to Face. Have a great night. We'll see you back here next week.